Welcome to the Deep Dive. Today we're jumping into a really interesting topic. It's about hope, medicine, and crossing borders specifically. IVF egg donation abroad.
Yeah, it's a path many take, filled with huge personal hopes. But it's also a really complex area. Our sources show it's got some hidden pitfalls.
Absolutely. So our mission here is to really unpack IVF egg donation in Malaysia. It's a very popular spot, isn't it? Especially for people from Singapore, China.
That's right. A big reason is the availability of paid donors there. But, under that surface appeal, the system is often described as having, let's say, lax regulation.
So we want to arm you, our listener, with the key info you need to navigate all this. We've dug into our sources for the critical insights, some surprising facts, actually, to help you get properly informed.
Because it's not always straightforward. Patients might run into, marketing tactics, maybe misleading info, and some pretty serious ethical issues, too.
Exactly. We're going to look at what you need to watch out for and really why it matters so much.
Okay, so where do we start? Well, our sources consistently point to one big underlying problem. This sort of regulatory void.
A regulatory void. What does that mean in practice?
Well, the Malaysian Medical Council, the MMC, they do have guidelines. They say, no commercial trading of gametes, eggs, sperm.
Okay, so there are rules.
Yes, but here's the kicker. They're not strictly legally binding. And in the private healthcare sector, where most of this happens, they're often, ignored.
Wow, okay.
Yeah.
So guidelines, but without teeth, essentially. That sounds risky.
It is. And, the Ministry of Health set standards for IVF centers back in 2012, but they didn't really touch on regulating surrogacy or donation sperm, egg, embryos.
And I read there was even proposed legislation.
Yeah.
Like an actual act.
Yeah, the Assisted Reproductive Technology Technique Services Act. Proposed back in 2009, again in 2016. Academics, stakeholders, they called for it, but nothing. It still hasn't materialized.
So what's the fallout from that?
The direct result. You get this rampant commercial trading. It's done by egg donor agencies, and they're completely unregulated, mainly in the Klang Valley, Penang area, and it poses, substantial risks for patients. It's like a Wild West situation almost. Yes.
Okay, so you're in this environment, kind of unregulated.
Okay.
And that's where the misleading practices can creep in, right?
Exactly. Let's talk about one big one, our sources flag. PGTA, pre-implantation genetic testing for aneuploidy.
Ah, yes, the genetic screening.
Right. And many Malaysian clinics really hard sell this. It's expensive, can bump up the total cost by 50%.
50%. Wow. And what's the catch?
The catch is huge. PGTA only screens for large chromosomal issues like Down syndrome. It does not check for single gene disorders, things cystic fibrosis, thalassemia, things like that.
So it's not a catch-all genetic test, even though it might be presented that way.
Precisely. It's completely useless for preventing most heritable genetic diseases passed down from a donor. And that critical detail often gets lost in the sales pitch.
That's a really important distinction. And is it always necessary, especially with young donors?
Well, that's another key point. Often it's not necessary for egg donation with young donors. Younger women just naturally have a very low risk of chromosomal abnormalities in their eggs.
Okay, so it's maybe more relevant for older women using their own eggs.
Potentially, yes. The data might show some benefit there, but that finding gets kind of misapplied to these young donor situations to justify the cost.
And are there other, maybe better options being ignored?
Yes. Our sources say clinics deliberately neglect simpler, cheaper things, like doing genetic carrier screening on the donor herself, just a blood test before the IVF cycle even starts.
Or maybe testing after pregnancy is established?
Right, like non-invasive prenatal testing, NIPT, that's done later. But instead, patients get pushed towards PGTA, which has its own risks, damaging the embryo during the biopsy.
And it depends a lot on the lab skill, I imagine.
Hugely. Human error in busy labs is a factor. And unfortunately, it's also sometimes used just for sex selection, which raises other ethical questions.
Okay, so that's PGTA.
Mm-hmm.
What about other things that seem simple but aren't? Like using frozen eggs?
Ah, frozen eggs. Yeah, they definitely have upsides on paper. Lower costs sometimes, easier logistics, because you don't have to sync cycles with the donor.
And you know exactly how many eggs you're starting with.
Exactly, certainty there. But, and this is a big but, the success rate is often significantly lower than using fresh donor eggs. That part tends to get downplayed.
Lower success rates, why is that?
It's partly about the freezing and thawing process. It's delicate. Think of it like a lock and key. The thawing technique needs to perfectly match the freezing method used.
So using eggs frozen at one lab and thawed at another could be problematic.
It really can be. The advice is preferably Use the same lab for both freezing and thawing. Definitely try to avoid eggs shipped between different egg banks and IVF labs if you can. It just adds risk.
Makes sense. Stick to one system. Now, what about the donors themselves? You mentioned Klang Valley and Penang. What if the clinic isn't there?
Right, that brings up the issue of traveling donors. Clinics outside those main hubs often fly donors in from Klang Valley or Penang.
Okay, I can already see logistical challenges there.
Big time. Especially monitoring the hormone stimulation. The donor might be given these expensive drugs that need refrigeration, and they have to self-inject, maybe supervised by an agent, not a nurse.
Oh, wow. What could go wrong there?
A lot. Maybe they don't stick to the injection schedule perfectly. Maybe the drugs aren't kept properly cold during travel. Spoiled medication. It can seriously mess with the egg quality and the number of eggs you get.
And I assume there are extra costs, too. Flights, hotels.
Yep. Cost for the donor, cost for the agency coordinator who travels with them. It all adds up.
So the best practice would be?
Use a donor who lives near the clinic if possible, and ideally have the clinic staff actually administer the injections, not rely on self-injection managed by an agent. More control, less risk.
Speaking of agents, our sources mention potential financial issues there, too.
Yes, financial exploitation. It's interesting. Sometimes it might actually be cheaper if you contacted a Malaysian egg donor agency directly yourself.
How so?
Well, when a clinic sources the donor for you, especially if it's not an agency they're formally affiliated with, they often add their own markup. They might call it an administrative fee or something similar.
So they take a cut?
A sizable portion, according to our sources.
Yeah.
You pay the clinic the total fee, and the clinic pays the agency, keeping a slice for themselves. It's a hidden cost layer.
Sneaky. Okay, moving into even trickier territory now.
Yeah.
The ethical side. Our sources mention something alarming: donor switching.
Yeah, this is deeply concerning because egg donation in Malaysia is anonymous. You don't meet the donor.
Right, so how does the switching happen?
Well, the anecdotal evidence suggests some less than scrupulous agents might swap donors if, say, the one you picked suddenly isn't available. Maybe her schedule changes.
And they might not even tell the patient.
Apparently, sometimes just matching by blood group. It's fraud, plain and simple.
How can patients possibly protect themselves against that?
One concrete tip: at the donor's first medical checkup for her health screening, blood tests the clinic should record her height, weight, and age. Patients should ask for this information and check that the height and age match the profile they originally selected. It's a basic check.
Okay, that's a practical step. Now, another ethical point raised was quite sensitive.
Yeah.
The risk of accidental incest.
Yes, this is a long-term concern. In Singapore, there's a safeguard. One donor can only contribute to a maximum of 5 families, 5 children conceived.
But not in Malaysia.
No mandatory limit like that in Malaysia, which means, theoretically, one donor could contribute to many, many families.
And over generations, that increases the statistical risk of half-siblings meeting and forming relationships without knowing they're related.
Exactly. It significantly raises that risk down the line. It's a serious societal consideration that the lack of regulation doesn't address.
And staying with the long-term impact. What about telling the children they were donor conceived? That's a huge decision for parents.
It absolutely is. And the advice from most experienced fertility counselors is clear. Tell the truth. Usually around the time the child starts school and begins understanding family concepts.
Why is honesty considered so important?
Because the alternative can be devastating. There's documented evidence, psychological studies, reports. Finding out accidentally, maybe during a family argument or later in life, can cause real emotional trauma, identity crisis, feelings of betrayal.
Right.
It can even lead to family estrangement.
And I guess with modern technology, secrets are harder to keep anyway.
Much harder. Think about direct-to-consumer DNA tests, 23andMe, Ancestry DNA, all those genealogy sites. It's increasingly common for donor-conceived individuals to stumble upon DNA matches, half-siblings, or even the donor's relatives completely unintentionally.
So the secrecy is becoming almost impossible to maintain.
Pretty much. Ultimately, it's the parents' decision, of course, but being open can lift a huge psychological burden off them, and it respects the child's right to know their origins. It often leads to more peace of mind for everyone in the long run.
Okay, all these points. The regulation gaps, the testing issues, the donor logistics, the ethics. Let's see how they can collide in the real world. Our sources detailed a particularly difficult story about a Singaporean couple.
Yeah, it's a really tough case study, but it illustrates so many of these pitfalls perfectly. They signed up with a clinic in the Klang Valley for egg donation.
Introduced to an agent, presumably?
Yep. They chose a donor, an expensive one, who matched the wife's blood group. An agent really laid it on thick, claimed the donor had very good egg quality, said she'd produced 16 blastocysts and 7 uploid embryos in a previous donation cycle back in January 2023.
16 blastocysts and 7 chromosomally normal ones. That sounds incredibly high.
It does sound very high, almost too good to be true. Remember, blastocysts are advanced embryos. Euploids are the ones most likely to succeed. Those numbers were likely inflated.
Okay, so potential exaggeration from the start. Did any immediate red flags appear?
Well, the donor's initial blood test suggested she might carry alpha thalassemia, a blood disorder. The doctor recommended genetic screening for her.
And did the couple agree?
They did. And crucially, they pegged the clinic RM3800 directly for the test. They were specifically warned not to let the agent handle it because of stories about agents altering health reports in the past.
Smart move, given the lack of agent regulation we discussed.
Very smart. But here's where the deception really kicked in. They were scheduled for their cycle in July. Unbeknownst to them, the same donor secretly did another full egg donation cycle for someone else at a different clinic.
Wait, another cycle? When?
The egg retrieval for that other cycle was on June 2nd, 2023, just 1 month before this couple's planned cycle. She even did her genetic screening blood test for the couple on May 25th while she was already taking stimulation drugs for the other patient's June cycle.
That's unbelievable. She was stimulating back-to-back with barely a break. That can't be good for egg quality.
You'd think not. And for the Singaporean couple's July cycle, the results were terrible. Horrendous, as our sources described it. Only 3 embryos developed, and all 3 were mosaic.
Mosaic meaning a mix of normal and abnormal cells.
Mm-hmm.
Highly unlikely to lead to a healthy pregnancy.
Exactly. Very poor prognosis, especially unusual from a supposedly young, healthy donor.
So what happened when the couple found out about all this?
Well, it took until late August for them to uncover the full picture. They found out the agent had lied about the donor's original January results, too. It wasn't 16 blastocysts, it was 8. And it wasn't 7 uploids, it was 5 euploids and 2 mosaics.
So the initial sales pitch was completely fabricated.
Completely. When they confronted the agent, she first denied knowing about the secret June donation cycle, then she just vanished. Blocked their calls, disappeared.
Unbelievable. What about the clinic? Did they take any responsibility?
The clinic basically washed their hands of it. They said donors are expected to be truthful and suggested the couple's poor result was just bad luck, cyclical variation.
But wasn't there evidence contradicting that? What about the secret June cycle?
Right. The couple found out that the June cycle actually had good results for that other patient's 6 blastocysts, 4 of which were uploid. So the donor was capable of producing good eggs very recently.
So it wasn't just cyclical. Something was clearly different or wrong with their July cycle.
Seems likely. Their own embryologist apparently noted the eggs retrieved in July looked not that normal, and another doctor commented that getting 3 mosaic embryos from a healthy 23-year-old donor was extremely rare.
And the financial cost to the couple.
They were out $55,000. But beyond the money, they felt completely betrayed, trust shattered, convinced the agent had lied, and the donor's back-to-back cycles compromised their outcome.
Wow. That story just ties everything together. The unregulated agents, the potential for deception, the risks with donor management, the lack of accountability.
It really does, and it powerfully underscores why proper legislation, like that stalled Assisted Reproductive Technology Act, is so desperately needed. It's not just about protecting patients, it's about Malaysia's reputation as a medical tourism destination, too. It's a stark warning.
So let's recap the key takeaways from this deep dive. We've seen how a lack of solid, legally binding regulation in Malaysia creates significant risks.
Yeah, and we've looked at deceptive practices like the hard sell of PGTA testing, which often isn't necessary or even useful for donor eggs, despite the high cost.
We talked about the hidden downsides, the lower success rates of frozen eggs, the logistical nightmares, and quality risks with traveling donors.
Plus the financial traps, like those hidden administrative fees when clinics source donors through unaffiliated agents.
And then the really deep ethical issues. The potential for donor switching fraud due to anonymity.
The increased risk of accidental incest down the line because there are no limits on donations per donor.
And the complex emotional challenge of telling children about their donor conception, especially in today's world of easy DNA testing.
Right. We really wanted this deep dive to give you, the listener, the critical insights you need to help you make genuinely informed choices if you're considering this path, and just to understand the hidden complexities involved.
It's about empowering you with that knowledge.
Exactly.
And to leave you with something to think about. When you have these powerful commercial interests meeting intensely personal medical journeys, all happening in a place without strong regulations.
Yeah.
What does that really mean?
Mhm.
What bigger questions does it raise about accountability, about patient protection, especially when healthcare crosses borders?